Today we're going to talk about the second reason that usually causes back pain. Before we go into the anatomy and how back spasms actually occur, we need to look at the why. Imagine you're lifting a heavy load that your body is not ready for. Most of the case that is a deadlift or a squat when people are in the gym, or you're sneezing out of nowhere and it's kind of caught your body by surprise. Whenever something like this happens, the body is trying to react in order to protect you from damaging yourself further. And the way the body reacts is a very overprotective mechanism that's called a back spasm. When the back is actually spasming, the muscles are contracting very hard. So if you're trying to stretch the tissue that's essentially contracting, you might actually cause it more harm than good. And instead of trying to stretch and contract the muscle, what's best to do is to essentially create movement in your hip joint. And now that you know that you should not be stretching a back spasm, let's have a look into the anatomy as to how that's actually happening. What I've highlighted here is essentially something called the latissimus dorsi muscle. This muscle covers quite a big area of the back section. As you can see, it starts all the way down here from the sacral area. It overlaps the pelvis and then connects into the arm. So this is essentially the only muscle in the back that connects the back itself, so the posterior chain, to the actual upper limb. What you can see underneath is something called serratus posterior muscle. This muscle is important as well because it essentially provides movement when we're basically breathing. So it brings the ribcage down when we're taking a breath out, so it allows the ribcage to basically condense down into its normal position. Here is something called the multifidi. So the multifidi is a very important muscle. So if I go ahead and isolate that, as you can see, this muscle covers the entire spine. So it basically begins from the bottom, as you can see there, from the bottom of the sacral area, and then it connects to the spinous and transverse process of each vertebra. It's all called quadratus lumborum. I'm just going to clear out the part so you can actually see it a bit more. So I'm gonna take away the deep core muscles such as the TVA, which is this now. And once I've taken that out of the equation, you can see the QL, which is this bit here, which I'm gonna highlight now. So I'm gonna go ahead and isolate this muscle, and now you can see its position. This muscle is really important because its connections are vital for the movements and stability of the lower back. As you can see from the image here, we've got the connection coming from the pelvis, on the anterior portion of the pelvis, to the last rib, which is there, and then so imagine if there's tightness or any kind of spasm that happens to this muscle. This muscle will basically clench and it will go into like a fist, and then it's going to start to pull on the 12th rib, the pelvis, and all of these vertebrae. So from L1 to L5, when you're walking around, this muscle provides the movement of the pelvis when the pelvis goes up and down. So when you take a deep breath in, the QL is the muscle along with the serratus posterior that essentially brings the ribcage down and allows it to go back to its normal position.